everyone, I'm Alice So, a current high school senior at Baby Secondary School in Ontario, Canada. And in the upcoming fall, I'll be attending Western University for Medical Sciences. A little bit more about myself, I'm passionate about menstrual equity and I'm an avid debater. Currently, I'm the president of Period Ontario, a chapter of an organization fighting to end period poverty and stigma. Outside of school, I enjoy kickboxing and bubble tea. In the future, I hope to become a family physician and conduct research into menstruation. So today I'll be going into the impacts of menstrual stigma, focusing on a lack of education, research, and policy changes to combat period poverty. Then I'll present to you ways that you can help achieve menstrual equity. So what is menstrual stigma? This is a discrimination against menstruators, where it is evident, well, from a young age, girls learn to hide menstrual products from prying eyes. They learn tricks to hide pads and tampons up their sleeves when going to the washrooms. They use euphemisms to refer to any menstrual-related word. They call periods a time of the month, and they refer to pads as napkins. Globally, over 5,000 euphemisms for the word period exist. The results? Menstruators internalize this stigma, and they become silent about any problems or symptoms that may arise from their menstrual periods. Menstruation is an important topic in global health because of the challenges that menstruators face in their daily lives and in healthcare. This social inequality affects people in all countries and in many aspects of their lives. So the key takeaway here is that the inability to move forward from this stigma prevents menstruators from having an equal opportunity to prosper academically and socially in comparison to their non-menstruating counterparts. So first of all, menstrual stigma prevents open dialogue and easily accessible resources for menstruators and anybody really to learn from. Without open dialogue or educational resources, misinformation can quickly spread or communication can shut down entirely. It makes one's first period a scary and confusing experience. Young menstruators can become embarrassed of their bodies, especially if they start their period at a young age, typically 9 to 10 years old, making them feel even more alienated by their peers. This harmful mindset has negatively affected girls' self-esteem, sexual and reproductive health, and school attendance. They're too ashamed to speak up about their experiences and too uninformed to understand if their period is abnormal or not, especially if they're experiencing a menstrual disorder, such as premenstrual dysphoric disorder, a severe form of premenstrual syndrome. How are menstruators supposed to maintain good menstrual hygiene for their health if they aren't even taught what it is or what it looks like? In many cultures, the responsibility falls onto the menstruator to figure out if their periods but often without the provision of sanitary products. In Nepal, menstruators are banished into unsafe and unhygienic huts to deal with their periods privately. Those who refuse were discriminated against and physically and verbally abused. One study states that the lack of education about this topic limited the community's ability to accept new practices. This inability to acknowledge menstrual health is harmful to menstruators and their ability to thrive in society. Moreover, the stigma towards periods extends beyond education and into research, lowering the quality of research done in connection with menstrual disorders and menopause with topics such as education, mental health, sexual health, and even genetics. Because this field of research is underfunded, many studies are based on small sample sizes or anecdotal data, which lead to inconclusive results. For instance, there have only been 2 studies conducted on menopause in Indigenous Australian menstruators. Though they experience some errata symptoms, there's not enough research to understand the mechanisms behind these symptoms. This causes their healthcare providers to be unable to effectively treat their problems. It is critical to have constructive discussion about menstruation so that menstruators can have access to high quality and equal healthcare. Lastly, the ability to advocate for one's menstrual needs becomes increasingly complex in low-income and Indigenous communities. They're unable to afford the high costs associated with menstruation, and governments often refuse to acknowledge this problem. For example, the United States of America does not include any period products in any of its welfare programs. One study even found that if you make minimum wage, 7% of your paycheck will go towards menstrual products in Canada, meaning that this is very important to include in welfare programs. Moreover, it's unethical to make a piece of cotton attached to a string cost $45 a package in Indigenous communities when it is the only thing keeping blood from seeping through their clothing. These communities already struggle with food insecurity and limited access to clean water, making menstruation an extra burden in their daily lives. How can menstruators be expected to advocate for themselves if their problems are overlooked and their experiences ignored? Disregarding these concerns severely decreases their quality of life. Government officials must overcome their stigma and listen to these communities by passing legislation to give them the help that they need and deserve. So how can you help combat this issue? You can advocate for policy changes that would help achieve menstrual equity. Such policies can include mandating menstrual health and hygiene as a topic in the school curriculum, or mandating that schools, community center, and workplace washrooms provide free menstrual products in their washrooms. In fact, Scotland made headlines as the first country to implement a policy to provide free menstrual products in schools and community centers to help eliminate period poverty. Additionally, you can advocate for menstrual leave, similar to maternity leave. Employers should not expect employees to come to work when they're experiencing symptoms such as nausea, cramps, headaches. Instead, they should be able to take care of themselves at home. Another essential way is to educate yourself and your community. This is very important, as without a change in attitude, society will only continue to perpetuate this stigma. The more you talk about this issue, the more normalized it will become. You can also support local non-government organizations fighting for menstrual equity. Join I Support the Girls, Period, the Pad Project, and many more NGOs just like them who help make a change around the world. Support Aunt Flo or Diva Cup, who so generously supply these NGOs with menstrual products. In conclusion, society must emphasize and reinforce understanding in all areas of menstruation so that menstruators can have the ability to feel comfortable in their bodies and participate in society with dignity. More quality research needs to be done in this critical area of global health so that menstruators can get the diagnosis and care that they deserve. Menstruators should not be punished just for having a uterus, and eliminating the stigma around menstruation and period poverty is integral to achieving a higher quality of life. Here is a list of references that I have used. And thank you so much for listening and coming to my presentation. Special shout out to my amazing team at Period Ontario who consistently motivate me and support me in the fight for menstrual equity. If you have any questions, feel free to reach me out on Instagram at alice@zo or my Gmail at alicezo2003@gmail.com. Thank you so much again and have a great day.